Trichinella sprialis by Jenny Parrish and Nadia Khan. Trichinella sprialis is the smallest nematode pathogenic to humans. The zoonotic parasite causes trichinosis. The roundworm infects humans by consuming raw, undercooked meat infected by pathogenic cysts. The most common infected meat is wild game and pork. Once ingested, the larvae develop in the gastrointestinal tract. The adult female can produce between 500 to 1,500 larvae. The larvae will migrate from the intestine to the striated muscles. The larvae invade individual muscle cells, turning the cells into nurse cells. Survival of the larva in the nurse cells can be as long as 40 years. Trichinosis appears as gastrointestinal symptoms within the first 2 days. Within 2 weeks, the symptoms become the following: muscle pain, fever, swelling of the face, particularly the eyes, weakness, fatigue, headache, chills, itchy skin or rash, cough, diarrhea, and constipation. These symptoms may last up to 8 weeks. Worldwide, it is estimated that 10,000 cases of trichinosis occur each year. The United States reports about 20 cases a year to the CDC. The mortality rate, however, is only around 1%. Over 1,000 larvae per gram of muscle are needed to become extremely ill. In contrast, however, 10 or fewer larvae per gram of muscle tissue results in no symptoms. The number of reported cases in the United States has dropped dramatically due to commercially raised pig and properly prepared pork. The cases reported are typically from eating wild game such as bear and boar. Key food and safety information. The following tips should help to prevent the spread of Trichinella spiralis. Number 1. Cook the meat completely. Methods such as curling, drying, smoking, and microwaving the meat are not effective methods for killing the parasitic larvae. Swine should be grain-fed, and free-range swine should be monitored to reduce the risk of infection.
22-year-old dancer Heather Wallace's body has broken out in a mass of red hives.
It was just weird, and I just wanted it to go away. I've never felt anything like this before.
She's so stiff that she can't really hardly walk, and I can't even imagine how she's gonna dance. It was just breaking my heart.
Desperate to find out what is causing her symptoms, she contacts a specialist at the Orlando Infectious Disease Center, Dr. Jose Alberto Giron. Dr. Giron starts by looking at the results of Heather's blood work. He's struck by a strange anomaly. Heather has a high white blood cell count. He orders more blood work. And 1 week later, when the test results come back, his suspicions are confirmed.
She has a parasite called Trichinella, and that her condition was trichinosis.
I'm dumbfounded. I can't believe it.
Trichinella spiralis is a parasitic worm that causes the deadly disease trichinosis. In the human body, the Trichinella spiralis larvae use their piercing mouthparts to cut into the muscle and tissue of their host. As the worm burrows through the flesh, the body's immune system attacks the worm, inflaming the surrounding tissue. This immune response is what's been causing Heather's skin problems, muscle pain, and paralysis. Heather contracted trichinosis by eating infected meat, most likely pork.
The only time it could have happened was at a company picnic where we had pulled pork sandwiches. Maybe, possibly, I could have gotten it there.